about middle adulthood. Um, it's from 40 to 65. I'm beyond that, so we won't start talking about me until later on in April, I guess. I just looked at the calendar. Next week. What is this week? Yeah. Anyway, we'll start talking about it next week. So let's go ahead and get started. If I can find it. There we go. Okay, middle adulthood chapter. It's not chapter 11. Wait a minute. It's chapter 14. There you go. It's chapter 14. Sorry about that. As I said before, middle adulthood runs from 40 to 65. Traditionally, it may be the most productive period of a person's life, though the end of middle age probably signals that you're going to retire. A lot of people retire at 65. You can start getting Social Security at 62, but you only get a percentage of what you would have gotten. If you retire at 65, you get 100%. If you don't retire until 72, which I didn't do, you get like 114%. I can show it to you. I think maybe I can. Whoops. Okay. Um, Retirement. Social Security retirement. Social Security retirement age. There you go. That ought to work. Full retirement age is 67 now. It used to be 65. Early retirement is 62. Delayed retirement. If you delay retiring benefits beyond your full retirement age, your monthly benefits will increase. I guess this changes with from time to time. Anyway, okay. So there you go. You get increased benefits. I get increased benefits. Lucky me, because I waited until I was 72. Ageism is unreasonable and irrational beliefs concerning people as they age. Modern society relishes youth and denigrates aging. Physical attractiveness is defined by youth, and people insult those who show signs of not fitting into their definitive definition of attractive. People reaching middle age will spend tremendous amounts of money to appear young, and we talked about that last week. There are reasons why the aging process is not well understood. There are many factors that are tied into aging, including life trauma. What traumas have you gone through? Environment. What environment do you live in? How has your diet been? Debts that you accrue, and the debts I'm talking about are physical debts like smoking tobacco, drinking alcohol, and taking drugs. And that will all of those will reduce the amount of time you get to spend alive. And then, of course, genetics are huge. Your genes will tell you how long you're going to live, potentially live. This is really kind of interesting because yesterday was it yesterday? Yeah, yesterday. I was talking to a guy at GNC. He's a friend of mine. He was one of my students when I was teaching at Ashford. Anyway, uh, he was telling me that there's a new, what did he call it? Peptides, and they think it's a new way to prolong your life is by taking peptides. GNC is really kind of interesting because there's a lot of, I mean, people go in there and they'll buy supplements that theoretically make them live longer. That's the idea anyway. And of course, bodybuilders will use, they can't use steroids, so well, they shouldn't use steroids. They're too dangerous. But there's another chemical. It's an amino acid called creatine, and actually my doctor prescribed it for me to maintain my muscle mass. is creatine. Anyway, there's a new one out, and it's called peptides, and evidently it's really really expensive. He was saying that this guy was bragging about spending $13,000 for 60 days worth of peptides. Yeah. Anyway, the strange things we do to stay alive. Stay alive longer. And we were joking about it. He said, the guy will probably get 3 extra months. Uh, at the time, that's going to be really important. But I don't know. Is it worth $13,000 to live 3 months longer? Who knows? Okay, so there's the environment. This is actually a picture of the Fort Belknap Reservation in the wintertime. And that is a road that goes to Great Falls. In a couple hours, you'll get to Great Falls. I think it does. No, it doesn't. This one goes to Billings. It goes through the southern part of the reservation. Reservation is the size of Delaware. Your diet. Let's supersize it. Those two guys are carrying a little extra weight. And trauma. This is some of the refugees trying to flee North Africa into a Europe. And of course, the deficits that you accrue. You can accrue deficits with drugs, alcohol, tobacco. All of these things will decrease the number of months that you get to live, despite the $13,000 you spend on peptides. What we've been talking about is secondary aging. Primary aging refers to normal age-related changes that everyone experiences, such as menopause in women and similar hormonal changes in men. And we will talk about those hormonal changes later in the chapter. While differences exist in when primary aging occurs, the experience is universal and falls within a normal age range. Life expectancy is the statistical figure as to how long an individual can expect to live. When I was born, I was born in 1949, and as a white male, my life expectancy was 59. Well, I'm 75. Guess what? My life expectancy as of today, as a white male, is 75.26 or something like that. And I've already gone beyond that as well. So I'm living on borrowed time, as it were. At least I'm living beyond my life expectancy. Life expectancy is actually a statistical average of how long people do live. Every country has its own life expectancy. In the United States, if you're a white female, your life expectancy is 82. Third world countries tend to have significantly lower life expectancies than industrialized countries. The countries with the lowest life expectancies are all African countries. In Malawi, people live to only be 37.6 years old. In Mozambique, it's 37.5. And in Zambia, it's 37.2. And those are all southern African countries in sub-Saharan Africa. The three countries in the world with the highest life expectancies are Japan, 80.7, Andorra, 83.5, and San Marino, 81.1. San Marino and Andorra are tiny countries in the Pyrenees Mountains of Europe. The Pyrenees are between France and Spain. Andorra has only 68,000 citizens, and San Marino has only 27,000. Flagstaff has 72,000, and Gallup has 21,000 people. So the San Marino, a country, has just 6,000 more people than Gallup does, and Andorra has 4,000 less people than Flagstaff. Life expectancy in the United States is 76.5. That is the average. The increase in life expectancy in the United States is partially due to a decline in infant and child death rate in the United States over the last 50 years. Heart disease has been cut in half in the last 30 years. Death during childbirth is rare, being female is a factor in longevity. 58% of people over 65 and 70% of people over 85 are female. So if you're looking for a date, if you're a male and you're looking for a date and you're over 65, that you're in pretty good shape. But if you're a female looking for a date, slim pickings, unless you're gonna find somebody a lot younger than you are. What was I thinking of? Life expectancy has actually declined for the first time in like 50 years. The life expectancy has actually declined because of vaccinations, because people aren't getting vaccinated like they were before, and that has cut the life expectancy. While life expectancy is a theoretical speculative number, longevity is actually the length of time an individual lives. Many people desire longevity, but most fear extended chronological age, actual number of years, and decrepitude, inability to function on one's own. Biological age is the physical age of the body in comparison to the chronological age. The longest recorded lives have been in the 120 range. Many gerontologists, which literally means old man studier, feel that 110 to 120 years is the upper limit of human genetic endurance. However, with advancing medical research and less traumatic lives, other scientists are predicting longer and longer lives. Many scientists see no reason to place a fixed limit on longevity. Thank you. I'll go as long as I can. Physical functioning reaches its peak during early adulthood, plateaus for a period of time that depends on the particular body system, then gradually declines after that. Most adults do not feel the impact of the decline before age 50, and some do so much later than that. Organ reserve, the extra capacity of lungs, heart, and other organs to respond to particularly demanding situations, shows the first signs of decline, but with no effect on normal activities. Most people enjoy good health and active lives for most, if not all, of their middle years. Most people do. Remember, this is to age 65, so it's not that 65 was 10 years ago. Strength slowly but steadily declines after its peak in early adulthood. It's so slowly that few people notice the change until they're in their 40s or 50s. After that, we experience approximately 8 to 10% reduction in strength for each ensuing decade. However, people differ greatly in the amount of strength lost. A study found that 29% of the middle-aged participants and 15% of the older ones lost no strength whatsoever. Okay, and that's my hope. He's got a problem. Look at his blood vessels. They shouldn't be sticking out like that. Unless he just lifted something. Anyway, she's pretty good. Look at her deltoids. That's pretty good. What people look like tends to be genetically dictated. Thus, people from one group may look old at 30, while another group maintains their skin elasticity and hair pigmentation into their 60s and 70s. I had a friend, when I was at Fort Belknap, I had a friend who was exactly the same age as me. His birthday was 2 months later than mine was. I was born in October. He was born in December of 49. And it really irritated me because my hair was gray. I was there in my 50s. I was 50 years old. We were both 50 years old. He didn't have the first white hair on his head, black as pitch. And I asked him, "Do you do anything to your hair? You're really driving me crazy." And he laughed and said, "No, I'm an American Indian." and our hair stays dark. And doggone it, his hair did stay dark. But just before I left, I was right around. I just crossed the six. We had just crossed the 60 threshold. I saw that he had a couple white hairs on the side of his head. Unfortunately, he passed away about 5 years ago. Sadly, he passed away about 5 years ago. He had been an alcoholic for about 25 years. But when I knew him, of course, he was clean and sober and had been clean and sober for a long time, for about 17 or 18 years. Young adults tend to have smooth, taut skin, and their hair has color, fullness, and sheen. Today's 20-year-olds are taller than their parents, and they tend to reach sexual maturity earlier than in past generations. This trend is believed to be due to improved nourishment, health care, and less physically stressful lives. Most young adults tend to be quite appearance conscious. They tend to maintain a slim, lean physique and wear clothes that accentuate this aspect of their appearance. We can say, yeah, the fact that so many women are wearing yoga pants and tights. As individuals approach middle age, their appearance tends to change. Skin elasticity decreases and facial expressions begin to mold people's faces into character lines. Both men and women begin to suffer from middle age spread, men tending to take on a spare tire, and women to grow larger thighs. Fat replaces muscle, of course, unless you lift weights. By late adulthood, physical changes become more obvious. Skin loses some of its color, hence the desire for tan skin among Europeans, and becomes splotchier. It begins to hang in folds and wrinkles and takes on the texture of parchment. Varicose veins may form in the legs, hair may turn white and thin, hair may begin sprouting in odd places, ears for men and chins for women. Individuals may begin using plastic surgery, heavier cosmetics, or Botox to rid themselves of age lines. They may deny their age and seek symbols of youth. They may take on younger lovers. Botox is a toxin. It's the toxin from botulinum, the bacteria botulinum, which will poison you to death. Well, you'll die. People die from botulinum. Anyway, Botox is a toxin from that, and what it does, it paralyzes actually, if you get botulinum, then your digestive tract becomes paralyzed, and then you die. And it's fairly quick. It's like if you ate something with botulism in it, then you'll be dead before the next day. That seems to be my emergency room experience is telling me that. So this is a toxin and it paralyzes things. So what they do, they inject it into your forehead, they inject it into your face, wherever you've got wrinkles, and then that part of your face can't do that anymore. Can't wrinkle anymore. That's Botox. Structural and functional changes. Joints. The joints are protected by a smooth protective cushion of cartilage. This is known as the meniscus. With age and use, the cartilage deteriorates and the smooth surface becomes pitted, and then you need to get it replaced. Bones. The bones become less dense, especially in women who have menstrual and partum drains on the calcium supply that they may leave the bones brittle and porous. The more babies you've had, the more you have drained your calcium. This is especially true of Asian and Caucasian women. Calcium is constantly being replaced, but in women, bone density loss begins to occur in their 30s. Male calcium loss in the bones doesn't begin until they're in their 60s. So seeing a man with osteoporosis is a lot rarer than seeing a woman with osteoporosis. Estrogen plays an important role in keeping blood calcium levels normal. In women, the estrogen promotes the absorption of calcium from the blood and into the bone. When estrogen levels fall, women no longer have the protection of estrogen to protect their bone mass, and that is during menopause. One of the most vulnerable bones in the female is the hip bone. A woman over 65 has a 1 in 5 chance of breaking her hip. Large bone fractures take much longer for an older individual to recover from than a younger individual. Osteoporosis or porous bones is a disorder of old age where the bones become thin and brittle because of calcium depletion. 1 out of 4 women in the United States will suffer from it. It is estimated that 1.3 million fractures a year in the United States are the result of osteoporosis. The spine is especially susceptible to the problem and is characterized by the classic hunchback posture. It's because of the deterioration of the vertebral support. Osteoporosis is more prevalent in white females and more pronounced in women of fair skin and small frames. Proper nutrition and exercise that begins in youth and is followed throughout life can help prevent osteoporosis. Smoking can exacerbate the problem in that it ties up vitamin D that is needed for the proper function of calcium. Arthritis is a general term that refers to inflammation of the joints. Arthritis is common in older individuals, but it can be found in younger people as well. Nearly half of the people over 65 suffer from some form of arthritis, and I do not have it. Osteoarthritis is the most common type of arthritis in the aging. Osteoarthritis represents inflammation and swelling in the joints. It is also common for this problem to be present when the joints begin to degenerate, and that's what it looks like when they begin to degenerate. Rheumatoid arthritis is a crippling disease that progressively destroys joint tissue. 70% of the cases appear between the ages of 25 and 70. It affects 75% more women than men. Cartilage becomes damaged and the joints become deformed, sometimes fusing together. Most people detect little effect of aging on their sensory motor systems until they reach the age of 50. At that point, hearing losses become more obvious. It's known as presbycusis, and the lens loses its flexibility, causing presbyopia. You suddenly become farsighted. Presbyopia is usually in the form of farsightedness and may require reading glasses, and that's what I'm wearing right now as I am lecturing to you. As the individual ages, it becomes more likely that a disease will cause excess pressure in the eyeball, damaging the optic nerve. This is a condition known as glaucoma. My brother has glaucoma. He has had it for about 40 years. I just had an eye exam Friday, and I got a fairly clean bill of health. I'm 20/17 in my left eye and 20/30 in my right eye, so a little imbalance going on. But I refuse glasses because I can correct it with cheaters, with readers. And there you go. As people reach middle age, many of their senses begin to decline. Besides presbyopia, some individuals may suffer from a yellowing of the lens, which filters out green, blue, and violet lights, making color acuity poor. If the lens clouds and becomes opaque, cataracts will form, making vision blurry and out of focus. And they checked my cataracts, or checked my degree of opaque light, of opacity, and they said it's minimal. so I'm good. 1.3 million cataract operations are performed in the United States every year. Older individuals will require more light because of pupil problems, and that is a problem that I do have. I need to be around bright light in order to see well. As people drift into middle adulthood, the sins of their past often will catch up with them. If they have not maintained a healthy diet or maintained a frequent exercise regimen, these practices may haunt them in middle age as damage to their cardiovascular system. Atherosclerosis is the buildup of plaque in the walls of arteries that may block or slow blood flow from a fatty diet. Arteriosclerosis is a loss of elasticity due to the hardening of the arteries from lack of exercise. And that's one of the reasons why I exercise so frequently. I lift twice a week and I try to walk every day. I didn't do so well today. I've only walked 7,000 steps, so I'm a little behind. Because of athero and arteriosclerosis, blood pressure is raised. Blood pressure naturally increases with age, but genetics and these conditions can lead to chronically elevated blood pressure or hypertension. This can lead to kidney disease, heart attack, or stroke. Hypertension can usually be controlled through improved diet, exercise, or medication. And I am on medication. I have had a heart attack, and I'm on a medication to lower my blood pressure. The system that tends to show the least wear and tear from aging is the digestive system. However, as an individual enters middle adulthood, digestive problems can arise. Ulcerative colitis, absorption problems leading to poor nutrition, gallstones, ulcers in the stomach, ulcers in the duodenum, hemorrhoids in the rectum and anus. And that's what a duodenal ulcer looks like, and that's what a gastric ulcer looks like. What causes it? Stress will increase the amount of acid that is produced in your stomach, and it will burn a hole into your stomach. Some people, they get just massive amounts of stress, doesn't bother them a bit. Other individuals are very sensitive to this, and they will develop ulcers. Another digestive problem that tends to occur during middle adulthood is type 2 diabetes, where the cells of the body become insensitive to the body's insulin. Type 2 diabetes becomes a problem with people who carry their fat in their gut and lean toward obesity. There is also a genetic component to this problem and is seen in select populations, especially American Indians. And that's type 2 diabetes. High cholesterol and blood pressure, having a large baby, being obese, being over 45, being physically inactive, and family history of diabetes. Those are risk factors. Breast cancer is a disease in which abnormal breast cells grow out of control and form tumors. If left unchecked, the tumors can spread throughout the body and become fatal. And there's a reason for this. There are lymph nodes right behind the breast, and it extends down into your armpits. So if you have breast cancer, and it starts to metastasize, it can get into your lymph nodes and spread very rapidly throughout your body. And this is one of the reasons if they find a tumor in your breast, they will remove the tumor, but and sometimes they will remove the whole breast because it is susceptible to more tumors. And when they do that, they will also remove your lymph nodes from your armpits. And the reason they do that is to make sure that they have the cancer. They don't want it to spread, because this type of cancer spreads very rapidly. Breast cancer cells begin inside the milk ducts and or the milk-producing lobules of the breast. Breast cancer can occur at any age, though incidence increases rapidly between the ages of 30 and 50, then continues to rise, but more slowly after age 50. Prostate cancer is the most common cancer in men. It is the third leading cause of third leading cause of death. What in the world did I think I was saying there? uh, of death. There we go. Okay, let's do that. Okay. My goodness. Prostate cancer grows slowly and is unlikely to produce symptoms. Oh, geez, what's going on here? My goodness. I didn't edit this page at all. Well, let me read this. I better go through this so that I can correct it. Prostate cancer grows slowly and is unlikely to produce symptoms, and this is one of the problems. I mean, you don't have pain. It's just there. Um, and then all of a sudden, you can't urinate because your prostate is blocking off your urethra. That's where this is your bladder, and it comes through your urethra so that you can urinate. It's usually discovered during surgery to relieve urinary problems by a routine digital exam. Wait a minute. Okay. Or by a blood test called PSA. And PSA measures blood levels of prostatic specific antigen, a protein that may be elevated when cancer is present. Oh, I see what happened. All right. Okay. That needs to go. There we go. The causes of prostate cancer are unknown. That's not true. We know what causes prostate cancer, and we've been talking about this for a long time. Your author is a female, and sometimes she just gets a little strange. Prostate cancer is caused if there's a buildup of fluid in the prostate. Now, the prostate maintains fluid in it all the time. So what needs to happen is that fluid needs to get out of there from time to time, and we know that. Individuals that are celibate, individuals that don't have sex, these individuals will develop prostatitis. Very readily. It happens, very frequently. The other individual that will develop prostate problems is an individual who has scarred their urethra. And how do you scar your urethra? You scar your urethra with sexually transmitted infections like gonorrhea and chlamydia. Especially gonorrhea will scar the urethra, in which case it kind of blocks the fluid coming down. And these individuals are susceptible to causes. Let me take that out of there. Anyway, yeah, I've been talking about this ever since I was in the service. We've been talking about what's going on with prostate. See, the part of the problem is that people don't like to talk about sexual things. As weird as that, well, it's not that weird, I guess. We live in a society that is afraid of sex. We have to repress all of this. It's just silly because this is life or death. This is just like everything else. It's life or death, and if we don't acknowledge it, then people are going to die younger than they should, or potentially anyway. So we do know where it comes from. It comes from either not moving the fluid out of your prostate frequently enough, or sexually transmitted infections that scar your urethra. And one of the ways we measure it is with the prostatic specific antigen, PSA. It's a good test. It does have some false positives, which is okay, because if it's a false positive, then there are other ways to check it. But it doesn't have false negatives. That's the good thing. Anyway, risk increases with age and with family history of the disease. I was told by my doctor now, by my GP right now, he was saying that all men over 65 have have prostate problems, and the reason they have prostate problem, well, it doesn't have to do with sexually transmitted infections. Anyway, so there you go. But the last time I had a PSA done, I was okay. Diets high in red meats and dairy have been linked to increased risk for prostate cancer. Among those who develop more aggressive, lethal forms of prostate cancer, some of the strongest risk factors are obesity, smoking, and low levels of physical activity. My wife has two male relatives, a brother and a cousin, and both of them have prostatitis, prostate cancer. Both are being treated. So, wow. And smoking and low levels of physical activity, that fits both of those guys. Prostate cancer grows slowly and is unlikely to produce symptoms. It is probably discovered by routine. Oh, I already said this. Huh. Oh, this is the one I should have done. That one, the other one wasn't supposed to be there. Okay. One of the most significant aspects of a female's life is her menstrual cycle. For 40 years, a woman's monthly cycle floods and depletes her system of hormones, controlling her reproductive capacity, and in some cases, controlling her moods and affecting her behavior markedly. During ovulation, when intercourse is most likely to produce a pregnancy, a woman's sight, hearing, and sense of smell are the most acute. During menstruation, all of these senses are the most dulled. Menopause takes place when a woman permanently stops ovulating and menstruating. Menopause usually occurs about a year after the woman's last period. Often women will ease into menopause over a number of years when their monthly cycle begins to become erratic, and this is known as perimenopause. The process begins about age 30 when a woman's production of ova begins to decline. As a woman approaches her 50th birthday, she begins producing less and less estrogen. Menopause occurs when the ovaries no longer produce enough estrogen to sustain full menstrual cycles. In 80% of the women, menopause occurs between 45 and 55. 75% of women experience little or no physical discomfort due to menopause. The most common symptom is known as hot flashes, sudden contractions of blood vessels causing blood to flow to the surface of the skin. Most women have hot flashes constantly, while others have none at all. Other symptoms of menopause include vaginal dryness, vaginal burning, vaginal itching, urinary problems, and vaginal infections. Menopause causes the vagina to become shorter and narrower, and the walls become thinner and less elastic. Lubrication diminishes, which may cause discomfort during intercourse or irritation to the bladder. Vaginal secretions become less acidic, since the acidity of the vagina protects the woman from bacterial and yeast infections. She becomes more susceptible to infection. Oddly, the more sexually active a woman is, the less drastic the changes in her vagina during menopause. Other symptoms of menopause include joint pain, muscle pain, headache, insomnia, fatigue, dizziness, weight gain, and constipation. Since the hormones that control menopause are the estrogens and sexual desire is controlled by testosterone, menopause does not decrease sexual desire. However, when vaginal changes create discomfort during intercourse or the woman suffers from other interfering health problems, menopause may mean a decline in intercourse. Some women may go through a sexual adjustment where physical responses aren't as extreme as they had been before. In the male, testosterone begins to decrease beginning in the late teens. By the age of 70, testosterone reduction has reached between 30 and 40%. The lowered testosterone and other sexual problems may lead to an old age of impotence. The prostate gland may swell and make urination difficult and erection incomplete. As males wander into their 50s, they may begin to feel their physical decline and waning testosterone levels. They may experience depression, anxiety, irritability, insomnia, fatigue, weakness, lower sex drive, erectile failure, memory loss, reduced muscle and bone mass, and body hair. Many men, as they age greatly, fear the loss of their sexual potency. It isn't true that as males age, they naturally lose their sexual functioning. This is basically a cultural idea. Very often, the lessening of sexual activity is due to non-physiological reasons: monotony in a relationship, preoccupation to business or financial worries, mental or physical fatigue, depression, failure to make sex a high priority, fear or inability to perform. Physiological problems include diabetes, alcohol, and medication that he may be taking. Male sperm count begins to decline when a male is in his late 40s or early 50s. Erections tend to become slower and less firm, orgasms less frequent, ejaculations less forceful, and it takes longer to recover and ejaculate again. 39% of 40-year-old men experience some sexual dysfunction. 5% of men in their 40s are unable to get and hold an erection. 67% of males over 70 experience some sexual dysfunction, and 15% are completely impotent. Erectile dysfunction may be caused by diabetes, hypertension, high cholesterol, kidney failure, depression, neurological disorders, alcohol, drugs, smoking, poor sexual techniques, unsatisfying relationships. Aging does not have to spell the doom of a couple's sex life. With many couples, menopause is liberating since the couple no longer has to worry about unwanted pregnancy as a result. The bottom line is that age has nothing to do with sexual drive and desire. Sexual expression may change its focus as a person ages, but couples are able to have sex as frequently as they want to have it. In many families, middle-aged mothers tend to have the role of kinkeeper, the person who gathers people together for celebrations and keeps them in touch with one another. Sometimes middle-aged parents are referred to as the sandwich generation because they're sandwiched in between aging parents and difficult adolescent children of their own. During middle adulthood, successful adults are able to maintain their mental capacities by adapting to their circumstance through selection, optimization, and compensation. They are selective as what they do, they optimize their abilities, they compensate when necessary. By using selection, optimization, and compensation, the individual is able to maintain their level of competence, regulate their losses by reorganizing their functions, and growing through adaptation. By focusing on what they are good at, middle-aged individuals are able to develop expertise, extensive experience, knowledge, and understanding of a specific area of interest. The antithesis of expertise is a novice, someone with very little experience, knowledge, and understanding of a specific area of interest. People with expertise may have a wealth of knowledge in an area, but will only use a small amount of that knowledge in any one situation, an aspect referred to as conditionalized knowledge. Even experts have different levels of competence. Individuals who have expertise that is basically routine are referred to as merely skilled experts. Those experts who can not only answer routine questions about their subject, but have such extensive knowledge that they have adaptability, flexibility, and creativity are referred to as highly competent experts. Highly competent experts become problem solvers in their field and can create strategies to expand their knowledge and develop new skills. This is known as adaptive expertise. Working memory is a kind of notepad in the mind for storing information in the short term so that it can be dealt with later. In fact, working memory used to be referred to as short-term memory. Working memory only holds from 5 to 9 chunks of information at any one time. Working memory can be enhanced if the individual arranges the information in larger chunks. Still, the working memory can only hold information for about 30 seconds before it begins to decay and possibly distort. Another enhancement tool that is frequently used is rehearsal, where the individual re-enters the information into the working memory by repeating the information. Researchers feel that as we age, the capacity of our working memory tends to shrink. Shrinkage tends to take a great deal, to have a great deal to do with the complexity of the task required and the technique used in memory enhancement. If the individual is using rehearsal as their memory technique, they tend to show very little decline. Any information that requires more sophisticated memory enhancement tools, such as reorganization, elaboration, or mental manipulation, there is greater decline. Some researchers feel that as a person ages, they lose attentional resources. They have less ability to maintain their attention on a select item. However, other researchers cite motivational lapses that might preclude an older individual from trying too hard on such nonsense. And that's my point of view. Well, okay, you got all these nonsense words. Why in the world would I want to remember any of this stuff? Scientists have recently been researching how select information is processed. Explicit memory is conscious or intentional recollection. Most often, facts, names, events, or other things that people can state or declare. Implicit memory is memory that occurs without conscious awareness. Most often, skills and habits, throwing a ball or riding a bike. Brain scans of people recalling implicit memory shows that there is a specific memory pathway that takes place when recalling this information. The car that I drive more than any other is my sports car. It's a manual transmission car. It's a 6-speed. 6 speeds. So I have to shift gears 6 times to get up to speed. And that's fun. It is fun. I enjoy it. But when I get into my wife's car, which is an automatic, sometimes I'm looking for the clutch so that I can shift gears. Yeah. Well, anyway, I haven't killed anybody yet. There have been, yeah, and it's really hard to find a manual transmission vehicle these days. You just can't find them. They don't make them anymore. They used to be called standard transmissions. They used to call them, when I was growing up, they called them standard transmissions because if you bought a car, you had to pay extra for an automatic. So the standard transmission was the manual transmission. It was usually a 3-speed or a 4-speed vehicle. And if you had most of them were 3 speeds. So if you had a 4-speed, it was potentially the fourth gear was a racing gear, and then of course the transmissions got a little bit more complex. And then the 5th gear, if you had a 5th gear, that was the racing gear. Overdrive, it was overdrive. And now I'm driving a 6-speed car, so that's well beyond anything else. I can remember the first sports car we had only had 5 gears. So sometimes that 6th gear, with people that grew up with manual transmissions, 4-speed was probably the highest they ever got to go. Anyway, not important stuff. There have been some interesting findings looking at the effect of sex hormones in memory. Dealing with animal studies, researchers have discovered that increased estrogen levels, as with birth control pills and hormone replacement therapy, decreases a woman's spatial reference memory, memory for location and space. Looking at male subjects, they found that when they increased testosterone, they increased spatial reference memory. Many parents, especially some women, so strongly identify with their mothering role that when their last child finally leaves the house, they may suffer from bouts of loneliness and feelings of worthlessness because their role has changed from the center of their children's lives to the periphery. And this is the empty nest syndrome. Fathers also may suffer from empty nest in that they may regret not having spent more time with their children. Do opposites attract? Well, not usually. Most people fall in love with and marry someone much like themselves. This is known as assortative mating. In fact, people who are about equally attractive are the most likely to develop close relationships. Lovers often resemble each other in physical appearance, attractiveness, mental health, physical health, intelligence, popularity, and warmth. They're likely to be similar in the degree to which their parents are happy as individuals and as couples. Now, the other thing that's interesting, if you ever see a couple where one of them is attractive and the other isn't, it grates on you. It's really odd. You'll see it and you go, "Oh, what the hell's she doing with him? What the hell is he doing with her?" It's really kind of bizarre. We keep making these value judgments about whether somebody should be with somebody else, even if they're just they're just with somebody else. Why should we care? Couples tend to be similar as their socioeconomic status, race, religion, education, and income. They often have similar temperaments. They often have similar interests. Researchers have found that people are usually more cognizant of why a failed relationship dissolved than why they got together in the first place. People and their hair color is the same. That's the bizarre part. People with black hair rarely marry blondes. This lady's actually has brown hair. You can see her roots here. Her hair's about that color, actually. And same thing with her. You can look at her eyebrows and look at her roots. She's not really a blonde. She's a brunette. There you go. Wow, their hair's almost exactly the same color. There, that's a little bit different. That's exactly the same. That's exactly the same. That's exactly the same. That's exactly the same. Yeah. Later years, the ability of older couples to handle the ups and downs of marriage results from mutual supportiveness, intimacy, sexual and emotional, interdependence, sharing of tasks and resources, the partner's sense of belonging to each other. In the United States, the average age of grandparents at first grandchild is 50 for women and 52 for men. Minorities usually achieve grandparenthood at a younger age than whites do. 70% of the older Americans are grandparents, 40% are great grandparents. Families are getting smaller. They're about a third as large as they were at the turn of the 20th century. In developing countries, the role of the grandparent is one of counselor and financial benefactor. In the United States, grandparents often act as teachers, caretakers, role models, and negotiators, but this is only about 15% of the grandparents. Involved grandparents represent about 15% of grandparents, involved to the extent of disciplining or correcting their grandchild. They give advice, they discuss the child's problems, consulted on important decisions concerning the child, exchanges help with errands, chores, and projects. They live close to their children. Younger grandparents, those who see their grandchildren almost every day, and those who have a close relationship with the child's mother, are more likely to be involved. Grandparenting styles may differ with different grandchildren and at times in a child's life. The most involved years tend to be when the grandchildren are pre-adolescent. One researcher from the 80s sees grandparents as family watchdogs. They often stay on the fringes of their children and grandchildren's lives, rarely playing an impactful role unless there is a need. In a crisis, they will step in with financial or emotional support. One study in 1987 found that 14% of preschool children were under the care of grandparents during the daytime. Grandmothers tend to have a closer, warmer relationship than grandfathers with their grandchildren and to serve more often as a surrogate parent. The mother's parents tend to be closer than the father's parents and are more likely to become involved in a crisis. Grandmothers tend to be more satisfied with grandparenting than grandfathers. Their grandfathers tend to be warmer to their grandchildren than they were to their children. Many feel that it is a second chance to do a better job at parenting than they did with their own children. 7% of children in the United States live in a household headed by a grandparent. 1/3 of these children have no parent present in the household. In some low-income areas of the United States, an estimated 30 to 50% of children are living in kinship care, living in households with grandparents or other relatives without their parents. Many of these children may have behavioral or learning problems due to a parent's abuse of alcohol or drugs. 68% of grandparent caregivers are white, 29% are black, 93% of single grandparent caregivers are women, 40% of grandparent caregivers are poor or just above the poverty level. 2/3 of custodial grandparents report a greater sense of purpose in life. Often the age difference between the grandparents and the grandchildren can be a barrier between them. They may feel anger or guilt for raising children who do not take care of their own children. They may feel that it shows that they themselves have somehow failed as parents. Age discrimination refers to denying someone a job or promotion solely on the basis of age. The Age Discrimination Employment Act of 1986 protects workers over 40. This law states that people must be hired based on ability rather than age. This law will not allow employers to hire or fire using age as their sole criteria. The law also keeps employers from segregating or classifying employees using age as the basis of this classification. Research shows that the idea of retirement is not universally accepted. The responses fall into three categories: those who are so attached to their work that they cannot imagine retiring, those who were looking forward to retirement as an opportunity to do things they hadn't done before, and those that had mixed feelings or hadn't yet thought much about retirement. In Germany, only 3% of older adults still work. In Japan, the percentage of old adults still working is 28%. In the United States, 16% of older men and 8% of older women are still in the workforce. In 1900, 67% of men over 65 were still in the workforce. In 1950, 50% of the men over 65 were still in the workforce. Individuals who continue working tend to be better educated than individuals who retire and tend to be in good health. Many people finance their retirement in various ways: social insurance, social security, universal pensions. Some countries automatically give each retired individual a pension. Voluntary pension plans. Most companies in the United States and Britain are allowed tax deferments to maintain a pension fund. Provident funds, similar to Social Security, but people get it all in one lump sum after they retire. While many people do prepare for retirement, just under half don't even think about it. But even the individuals who plan tend to aim too low. Savings programs need to be maintained at higher levels than most people are maintaining them. Not only that, but with inflation, the money you were making 10 years ago isn't going to make it in 20 years from now. Filling time, what do people do after retirement? Many maintain supplemental paid jobs. People who were self employed before retirement tended to work at least part time after retirement. Volunteerism, 1 out of 3 people over 75 do volunteer work. 40% of all retired people do volunteer work. Leisure, people tend to find a focus after retirement. Some people maintain a family focused lifestyle that means moving closer to grandchildren. Some people maintain a serious leisure where they must maintain skill and concentration in their endeavors. After 11%, about 11% of the U.S. retired people live in poverty. This is down from 35% in 1959, and the vast majority before Franklin Roosevelt passed the Social Security Act. After retirement, age often dictates poor health, but the vast majority of people are fairly healthy, both mentally and physically, until just before they retire. Generativity versus stagnation. Erickson's seventh crisis occurs at least by the beginning of middle adulthood and lasts until retirement. The crisis involves whether the individual will guide the next generation or whether they will focus on their own needs. This crisis is often resolved as soon as the individual decides to have and raise a family. People who put off relationships and a family are often too self absorbed to care about generativity. In 1968, Robert Peck looked at Erickson's idea of generativity and expanded on how people change their focus as they enter middle age, valuing wisdom instead of physical powers, socializing instead of sexualizing human relationships, concentrating on many people rather than investing all of one's time in one individual, mental flexibility instead of mental rigidity. And that is the end of the lecture. I should take that one out, that last slide. Anyway, there you go. Oops, sorry.